Hi, Dr. Yass here, and now I will provide part 2 of the video session that we had earlier this week, which was regarding groin pain from the hip nonsense. In the earlier video, I discussed how the idea of trying to diagnose being bone on bone at the hip through an X-ray or MRI was baseless, and that you actually needed a physical presentation, which was a major loss of range of motion, and at that end point where you couldn't push it any further, it felt like a bone was hitting another bone as the only true indicator whether you are in fact bone on bone. In the thousands of cases I have treated where the person was told they were bone on bone, in only 2 cases out of thousands did the individual actually present as being bone on bone. I referred them for hip replacements. The other thousands of people were shown to have muscular causes, resolve their pain through targeted strength training. So we discussed how to know whether you are in fact bone on bone with the hip, and also how the idea of the hip joint referring symptoms to the groin area is nonsensical, because joints don't refer symptoms, muscles and nerves do. So now that we've discussed that, we're going to go further and now actually discuss what is causing your pain at the groin. And for anybody who actually subscribed to Dr. Mitchell Yass, the YouTube channel, thank you for doing so. So you got the notification when I was actually going to be releasing this video. For anybody else going forward, if you want to know when I'm releasing new videos which are applicable relating to pain and dysfunction and strengthening and all these other things, please subscribe to Dr. Mitchell Yass. Okay, so if you are having pain in the groin, the highest probability is that it's a muscular cause, and that's simply because muscles exist in the groin area. There is the sartorius muscle, the gracilis muscle, even the psoas muscle, which sits very, very high up in the groin area. Typically, one of those 3 is the cause. What you want to recognize is that along with your symptom, there's also some sort of inability to weight bear on one of your legs. One of your legs, you're going to find it harder to single leg stand and single leg squat. The reason for this is the fact that this muscle right here, called the gluteus medius muscle, has strained. This is the muscle that provides balance and stability. When this muscle strains, the pelvis will sink or rise, depending on whether another muscle wants to try to assist. But once you have this variation in the pelvis not being level, other muscles can then begin to have an altered length. So if this were to drop, then this point here drops and gets closer towards the attachment of these muscles that attach from the groin area into the knee joint. So as they shorten, they can strain and become susceptible to eliciting pain. There are other factors. We could muscle test. We could press on the muscle. So for instance, this is the hip joint. No one really knows where the hip joint is, but if you, as I discussed earlier in the video, were to compress this, that would be able to show whether the pain is in the actual hip joint. But pain anywhere above it, on the inside it, in the gluteal region, would show that it's a muscular deficit, because you're actually pressing on a muscle. So that's pointender pain. Pain where I'm pressing, which would tell you the tissue I'm pressing on is the tissue eliciting the pain. So you could press into the gluteus medius, you could press in the groin area and try to identify whether it's the sartorius, the gracilis, or the psoas muscles. Once you've identified the cause, which in the case of the sartorius or the gracilis is a strained gluteus medius, then you simply have to know which exercises to perform. And so for the gluteus medius, that would be hip abduction. There's an exercise to lengthen the sartorius muscle. You typically want to strengthen some of the associated muscles, the gluteus maximus, the butt muscle, the hamstring. And there is a series of exercises that can be done to resolve that groin pain. But once you've confirmed that the pain is not coming from the hip joint, and you can recognize that there's other indicators beyond the pain, such as altered posture, an alteration in the ability of your pelvis to be level, an inability to weight bear, single leg stand and squat, from a functional standpoint, now you could start connecting the pain to a muscular deficit. And that's where the Yass method separates itself, because no medical specialty is educated or trained to identify muscular causes. And yet, the Yass method has shown that over 98% of cases, the cause is muscular. So, if you have groin pain and you want to go forward, I would suggest you contact me, Dr. Mitchell Yass, at my email address, drmitch@mitchellyass.com, Dr. Mitch at mitchellyass.com, if you would like to actually perform a Skype session or Zoom session with me to help you confirm whether the cause is muscular, and if in fact it is muscular, which muscles need to be strengthened and how to strengthen them using progressive resistance, which is at the core basis of how the Yass method treats symptoms, then again, you can contact me at drmitch at mitchellyass.com. Don't depend on the medical system to resolve the cause of your groin pain. It doesn't matter what specialty you go to. The reality is that the medical system primarily diagnoses through the use of diagnostic tests like x-rays and MRIs. They will always find a herniated disc or stenosis at the back, meniscal tears at the knee, labral tears at the hip, arthritis throughout the body. And the reality is these simply exist and will have nothing to do with your pain. Once you've recognized your pain is associated with you doing stuff, it is muscle. You need to establish the muscular cause and resolve it through progressive resistance exercise. Again, if you like this video, you're seeing that these videos I'm coming out with are very applicable and make sense to you, please give it a thumbs up. Again, if you like these types of videos and you're seeing them help you be able to resolve your symptoms, please subscribe to Dr. Mitchell Yass, my YouTube channel. It helps Google and YouTube to see that there's value in these types of videos and will help them to suggest them to others who are searching for similar types of issues when they're putting their information into their searches. So please, let's help everybody resolve their pain by spreading the word of the Yass method. For now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.